Hi, everyone, and welcome to our webinar on improving patient access through adequate call volume forecasting. We're going to explore tools to enhance forecasting accuracy, enabling healthcare providers to efficiently manage inquiries without compromising quality of service. We're going to cover case studies highlighting the impact of precise forecasting on overall healthcare efficiencies. And today, part of our key takeaways will be to understand and accurately model factors that drive call volume variability. We're going to learn about the latest technologies and methods for forecasting call volumes and their application in healthcare. We're also going to discover the best practices for integrating accurate forecasting into daily operations to improve patient access, reduce wait times, and enhance satisfaction. So today I will be assisting you and co-facilitating this webinar. My name is Lillian McCann, and I've been working in the healthcare industry for the last 7 years through CCD Health. Let's dive right into the meat of the matter, right? When we look at call volumes, one of the first things that we ask is, why does it matter? Basically, inaccurate call forecasting can lead to hitting costs that negatively impact patient experience. There's a financial impact where unhandled abandoned calls will have a direct hit on revenue. The reality of calls holding for anywhere over 4 minutes during peak season when the industry standard is hovering around 50 seconds has something to do with that. Poor resolution. We are seeing industry-wise that there's only about 1% of the facilities that meet a first call resolution rate, with the remaining centers requiring some type of callbacks, degrading the patient experience and increasing the risk of churn with patients that are seeking referrals elsewhere. These factors will also seep into the impact of the volume variability at the different sites as well. And the three main drivers of the volume variability are financial, operational, as well as patient experience. The key impact on the financial loss of revenue are missed opportunities. So at the center level, we need to align average handle times as well as achieving first call resolution as much as possible. There could be operational inefficiencies, as mentioned, such as incorrect resource allocation, increased turnover at the sites, as well as improper training. All of this will impact patient access and have issues with the patients, providing a risk of churn, as mentioned before. So understanding the volume patterns, how high they're going to come in or how low they're going to be during those variables, peak times, will help prevent bottlenecks and long wait times. Basically, a lack of insight into these volume patterns can lead, again, to inefficiencies that are going to impact all three of those areas. To go into an example, we can review supply and demand imbalances. Here we're going to see a chart where we can visualize the imbalance between appointment supply, which is basically the fixed provider capacity at the site, and the demand with any fluctuating patient requests for new patient appointments that come in. This is data from a U.S. primary care practice in 2024, and the data that's provided is from a 2025 Access report that we investigated. Okay. When we look at this graph, the supply is in the gold dashed line. This is going to be an assumed constant. So it's about 500 slots per month due to this fixed provider's capacity. We can also see the demand in the black line of the chart where it fluctuates based on seasonalities, based on trends, and any type of utilization pattern coming across. The purple shaded area in the graph indicates months where demand exceeds the supply. This is resulting in the longer wait times and scheduling backlogs that could occur at the site. A demand fluctuation examples could be time frame patterns. If we look at this graph between the March and April, around that season, we can have anything a variable such as post-winter checkups that are coming in. There could be a flu influx. Insurance deductibles reset around this time frame also, which increases the demand. When we look at some of the imbalances with July and August, we can assume that part of these have to do with back to school sessions, back to school physicals, any type of summer related healthcare activity that's also needed. And when we look at the reduction of the demand, we could also imply towards the end of the year that these drop due to holidays. There could be patient delays because visits become non-urgent. Everyone's focusing on something else. And obviously, it's very important to understand these. There are about 42% of Americans that will worry about undiagnosed conditions. So that also plays into that demand and balance during certain seasonalities of the year. Why does it matter to understand these, right? Patients face long wait times for appointments. There could be anywhere between delayed care that's also going to lead to poor outcomes and patient attrition to competitors. Some of the key recommendations that we can provide based on this supply and demand imbalance is to monitor your seasonal trends. You need to analyze the historical data and try to predict as closely as possible your high demand periods and proactively adjust your scheduling. By adjusting your scheduling, you could be looking at your expanded capacity. For example, during the peak months, March through April, July through August, we could extend provider hours, for example, or even hire temporary staff. Another recommendation could be to adjust your systems. We could implement possible automated overbooking reminders or even leveraging artificial intelligence driven scheduling tools that will dynamically balance the supply and demand for your center. No, a lot of consumers or patients still prefer scheduling new patient appointments over the phone versus AI. However, this is transforming little by little. When we talk about schedule optimization, we have to look at the different gaps that we have. Okay. Healthcare providers can optimize scheduling by addressing 4 quadrants of the supply and demand gap. I'm going to present these 4 quadrants to you, and basically, on the left side, you're going to see the high demand and high supply. Ideally, a lot of folks like this quadrant, but it could be very fragile because poor scheduling can lead to patient frustration when this occurs, or underutilized providers at the different physician offices, or underutilized equipment at the different outpatient centers that work or process imaging, for example. This quadrant is ideal for implementing AI-driven scheduling tools so that you could automatically fill those different slots and optimize the utilization. The second quadrant that we're going to talk about is the high demand and the low supply quadrant. This is a very common challenge. There are longer wait times and there's high patient frustration due to different physician reports. There could be patient delays due to provider shortages. So increasing your provider capacity or increasing your hours of operations, or using AI virtual queues to predict no calls and dynamically rearrange your slots could be a possible workaround for this quadrant. There's two more quadrants we're going to talk about, and the next one is low demand and high supply. Underutilized capacity, lost revenue, waste of resources, and potential for staff layover or layoff usually occurs here. So utilizing any type of predictive analytics and patient outreach to forecast this demand and proactively adjust will strengthen your referral networks in this quadrant. The final one that we're looking at is the low demand, low supply. This is mostly often seen in rural or new practices. It's limited to patient request and provider access, and it expands services towards more usage of telehealth and flexible hours. A used targeted marketing to research the local community would assist greatly here and address any type of access barriers, such as transportation, that sometimes occurs in these areas. Call volume forecasting is crucial because patient-initiated patterns significantly impact operations and satisfaction. So we do see that there are common patient-initiated call types. Some of these are new appointment schedulings, anywhere between an appointment change or a confirmation that needs to occur. Clinical questions such as follow-ups, post-visit inquiries, test results are extremely important and are generated by the patient usually. Insurance or billing inquiries in regards to the documentation received that they don't understand, so they want to call and find out what's going on. Another common type of patient call is prescription refills, and these impact patient satisfaction when not handled correctly, because at the end of the day, when we're not providing a timely response, we're deteriorating the trust of the patients. So in order to deliver a positive patient experience, we want to ensure that the different facilities are well trained and can deliver that first time response as quickly as possible, to ensure that that trust factor is still there. Some of the operational efficiencies and financial performances that could be impacted based on forecasting can drive a deterioration in financial performance. So making sure that this is as accurate as possible and ensuring optimal staffing will reduce part of these operational costs. When we look at the abandonment rate impact, an example that we can talk about is any call center or patient call center that could handle 2,000 phone calls a day, and a high abandonment rate, close to 7%, could basically impact 140 patients from being attended in a timely manner, or 140 patients that are giving up and not calling back during the next couple of windows. This could have a compounded effect because it could lead to fewer bookings than what is ideal for the site. Research has shown that a superior patient experience generates higher financial performance than average providers. So, in summary, we want to ensure that whenever we're doing forecasting, looking at those different imbalances, looking at the supply, understanding the reasons the patients are calling, so that we can figure out those fluctuations during those time periods will deliver a correct resource allocation, improving the patient experience, reducing those abandonment rates, and increasing financial performances. We're going to go ahead and talk about two different forecasting or modeling methods. Eh, One of these methods is the traditional forecasting method. And when we see this, we're going to see historical averages as well as trend analysis. We can see a regression analysis as well. So I'm going to go ahead and dive into some of these components. The traditional forecasting method is used highly in healthcare centers, and it's actually adopted from traditional customer care and or BPO models. When we look at historical averages and the trend analysis, this uses past volume data to predict future demand based on week over week, year over year, or even month over month variability. Identifying seasonal fluctuations as well as daily peaks. For example, anticipating a surge during the flu season is part of using this type of analysis. The other part of the series is a time series analysis. This basically looks at the different statistical techniques to model and forecast volumes based on historical temporal data, focusing on patterns and seasonalities over time. We could also look at the seasonal decomposition model, which will break down the data specifically for the time frame, the season, and the trend, and look at those residual components so that we can adjust the staffing during predictable high demand periods based on those trends. For example, one that we mentioned earlier are those insurance open enrollment seasons towards the earlier segments of the year. And finally, we're looking at the regression analysis. These are usually linked to marketing campaigns that come across for those different call volumes. This identifies a direct relationship between your influx of patients or your influx of call volumes with external variables to the site. So that's why I mentioned those marketing campaigns. So anything in regards to public health alerts, new physicians joining a network and their patients coming in will positively manage the influx of volume so it's going to be very important to proactively manage the staffing around those marketing campaigns or those different variables that are going to surge your normal patterns of business per se. Let's go ahead and look into some more modern forecasting. These are usually based out of artificial intelligence tools. Basically, artificial intelligence is transforming forecasting from static models to a more dynamic learning system that's integrated across the whole patient journey. AI tools function to benefit in providing automated pattern detection uses, machine learning to find complex hidden patterns that usually a human interaction or a human analysis could miss. It could provide highly precise predictions, such as pinpointing call spikes as soon as 2 days after a specific physician visit. Real-time adjustments, continuously monitoring live call patterns, and is instantly adjusting these predictors. It solves the problem of outdated static models, as this is a living model that's going to adapt as the day-to-day unfolds. It goes deep into electronic healthcare records and connecting these directly to the scheduling systems, eliminating fragmented data visualization, and it creates a single cohesive ecosystem for a better visualization, as mentioned before, and just painting a complete picture. Um, we could also look into other factors such as anomaly detection acts. As an early warning system, these would automatically flag unexpected spikes or drops in call volumes, enabling instant reactions and rapid staff relocation, preventing any additional type of inefficiencies before we escalate those. These tools combined from multiple sources try to create a truly holistic forecast. Again, there's an EHR system that has the patient demographics, the appointment history, and the no show history. It puts together the whole marketing campaigns that could be generated by lead generation or different outreach events. It also looks at integrating those external factors such as weather predictors, public health alerts, seasonal illnesses, as well as provider data with the staff analysis. So, again, looking at more technology based tools to enhance the center's forecasting is also a great component at this time to facilitate as well part of the financial burden that could come along. Um, the imaging of the patient journey, when we look at this is actually mapping part of the healthcare imaging journey, and it integrates advanced forecasting at every touch point. When we look at the phase of AI and the application and forecast impacts, we're also looking at pre-service referrals, predictive surges and order authorizations, analyzing patient history location for optimal appointments, reducing no shows, and streamlining scheduling to create value before the patient even arrives. Some of these accessibility fronts would also provide a check-in efficiencies and arrival times based on some of those traffic and weather patterns mentioned below. It also allows for real-time staff adjustments, ensuring smooth and efficient reading schedules. The most powerful component of all of this, in all honesty, is the continuous improvement loop. Every interaction and every data point feeds back into the system. It consistently improves the AI model implemented, predicting accuracy across every single one of the touch points, and can shift care from being a reactive service to a truly predictive service. Um, we have a case study that we'd like to demonstrate now in regards to a no-show predictive model that CCD Health developed. Our predictive model estimates the likelihood of a patient missing a scheduled appointment utilizing risk scoring system. Um, this model uses approximately 24 months of data for a scheduling grid from an EMR system. It factors the different patient demographics, the distance from the facility, the type of appointment, the time of day to the appointment, lead time, past attendance history, day of the week, season, amongst other factors. One of the outputs that this model provides is each upcoming appointment receives a risk score. This could be from 1 to 4, basically. And part of the proactive action is to use this score so that we could predictively identify steps as additional reminders for these patients that are potentially not likely to show. It also provides a different results or outputs that could be taken based on these slots. So you could start overbooking as part of the optimization tactics when or where these items are identified. Um, the no-show rate for the highest risk segment, basically a score of 4, is over 4 times likely the market average of not showing. So, implementing the no show predictive model yields substantial gains in revenue, access, and efficiency. Let's look at a scenario from a sample imaging center that schedules anywhere around 30,000 appointments per month. When we look at this, there's a possible risk of about the top 10%, which is about 3,000 appointments that are most likely to not show. These historical misses of these high risk groups of the no show missed appointments per month could target a potential recovery, right? If we were able to identify these in a timely manner and overbook them or something of the sort. When we look at this, our yearly recovered revenue by implementing a no-show model is anywhere about around $1.2 million for a small facility. So obviously there's going to be an ROI, but there's also going to be an operational benefit where your staff can focus on outreach efforts during the highest slot risks, allowing for strategic overbooking without impacting the patient experience. We could also have some takeaways where predictive analytics are going to shift that scheduling from a passive process to an active optimization, improving both patient care and financial outcomes. When we look at some of the closing thoughts for today, we can look at an implementation roadmap of forecasting in healthcare. Basically, implementing this requires a phased strategic roadmap. It requires access and planning. Here, you're going to review and analyze the different phases required for the implementation. The second step is to see any deployment of technologies that could be integrated, deploying artificial intelligence tools and integrate them with existing systems such as your EHRs and scheduling grids. Using APIs or other integration components could be part of the analysis phase. Change management is always something that we need to look at and focus on ensuring proper training is delivered to the staff in order to engage and ensure accurate and correct processes are delivered based on the design. We could also optimize and measure the ROI if done correctly, and ensure a continuous improvement cycle where we start the post implementation cycle of that ongoing a optimization stages, always looking for what we could do better, what we could do more efficiently, and what we can tackle. At the end of the day, the future of patient access depends on organizational readiness to embrace advanced forecasting technologies, and part of our transformation is going to require that we address any resistance through transparent communication. Stakeholder engagement is also key at this step. I think the patient access impact that we're looking for in our day to day is reduction of those wait times and lower abandonment calls. We want to optimize the patient journey from being the referrals to having a completed procedure, basically improving the satisfaction. We want to ensure that the financial drivers are always delivering high revenue recovery year over year through no call or no show reduction and improved resource utilization. At the end of the day, patient access is not just about efficiency, it's about creating patient experiences and making sure that these are exceptional. I want to thank every single one of you for joining us today once again. And I hope that this webinar was of value to you, to many more learnings. Have a great afternoon, everyone.